Now, the National Health Department is turning its eyes to the Western Cape, with the province emerging as a hotspot for COVID-19 cases in South Africa. The province now accounts for more than half of all confirmed cases. South Africa now has over 10,000 cases, and according to figures released today, the Western Cape has 5,621, or nearly 53% of the overall total 10,652. The Western Cape also reported 8 out of 12 new deaths. To discuss, we're now joined by Dr. Kerrin Begg, public health specialist from the UCT Faculty of Health Sciences. Doctor, thank you for being with us via Skype. Firstly, many of the travellers maybe that initially brought COVID into South Africa stayed in the Western Cape, or is it something about conditions there that's facilitating the spread right now?
Thank you, and very nice to be online. I think that there's a couple of things. Firstly, is the data telling us everything? So first of all, we know that Western Cape has a different testing strategy to the rest of the country. That testing strategy looks at particularly clusters, so is very targeted. So we know that the Western Cape detection rate, in other words, the number of cases versus the number of tests, is close to 9% at the moment. Versus, in fact, over the last 2 weeks, it's gone up to 14% numbers of cases detected over numbers of tests done. So they're very efficient at detecting the number of cases, versus the rest of the country has remained at a 3% detection rate. So in other words, Western Cape are finding the cases that are there. We're not sure that the rest of the country are actually finding all of the cases that are there. Sometimes if we look at death data, we can start to work backwards. So we know that around the world, around 1%, there's about around 1% case fatality rate. So if we look at those 206 deaths for the country, we can say that we probably actually have 20,600 cases in the country that are symptomatic. And if we were to think of another asymptomatic, we probably are closer to 40,000 cases. So what we may be seeing actually is just that Western Cape are more efficient and effective at detecting cases than the rest of the country. We should be seeing around about 20,000 to 40,000 cases in the country, and we only see 10,000.
This is very interesting because some commentators are saying that Western Cape is doing a lot of testing as well. I was looking at the numbers. It looks about 17% or so of the total number of tests have been done in the Western Cape. That doesn't seem huge, but you're talking about very targeted, going into the right areas, finding the right clusters, preventing the spread.
Exactly. So it's not necessarily about the numbers of tests alone. It's about finding the right places where you are expecting to find positive cases. So when you do mass screening, community-based screening, you're going out and you're finding a needle in a haystack. What the Western Cape are doing is saying, we know more or less that the needles are sitting in the bottom left corner of the haystack, and so we're going to focus on the bottom left corner to find those needles. And that's because when we see that the workplaces, we see 3 cases or more in a workplace, then we specifically hone in on that workplace and start to test anybody who has symptoms. And in some cases, we are even testing asymptomatics. Yeah. So that's a really important part, as also to make sure that we test all of the deaths. So at the moment, deaths we presume that all of the deaths are actually being counted. However, in the Western Cape, we know that some of our deaths have occurred on admission. In other words, the first time we know that they are COVID positive is when they arrive in hospital, and sometimes die the same day, and so we actually get their results maybe a day or two later. We're not sure that that's happening in the rest of the country, that we're actually making sure that around the death and after the death, so post-mortem, we still are detecting COVID-positive cases. So we probably are in a situation of under-detection in the rest of the country, We know we're still under-detecting in the Western Cape, but probably to a lesser extent than in the rest of the country.
Yeah. The Health Minister said yesterday that government noted with concern that the Western and Eastern Cape combined comprised 84% of new cases. So that's looking at potential rise in the Eastern Cape as well. There's a lot of movement between these two provinces. Is there a specific link between these two provinces that is proving to be dangerous?
So we know that this is a disease of gatherings, and therefore we see most of our cases in the metros. So in Cape Town, so in fact it's not even in the Western Cape, it's predominantly in the metro. Similarly, our initial infections were in the metro in KZN as well as in Gauteng. We're starting now to see spread into the Eastern Cape, and part of that has been linked to gatherings. So the particular links that we've seen are around funerals, where people have travelled between Eastern Cape and Western Cape, and we've had cross-infections, particularly around attendance of funerals, which is particularly sad.
Yeah. Doctor, one of the things you've touched upon is gatherings, our measures to prevent that, part of the whole lockdown debate happening in South Africa. Moving from 5 to 4, was that a good idea in the Cape? Some looking at the visuals of Sea Point said no. I mean, has that hastened the spread? And what about the lockdown in general? I mean, Sweden is claiming success because it followed a herd immunity strategy. Some people are looking at their numbers saying that was just bogus. They should have locked down, in fact.
Yeah, Sweden is not a great example. Sweden have significant deaths and cases. So let's talk about South Africa. We certainly have seen a delayed, from the early modelling, looking at our numbers of cases, we should have seen these kind of rises in cases much earlier. So we were anticipating being close to our peak round about now. So we certainly have seen the benefits of an early lockdown and an early state of disaster declaration. You must remember that the state of disaster declaration was also significant in that it restricted movement prior to the lockdown. So all of that contributed to a delayed peak that we're seeing, that we're benefiting from now. Of course, the challenge is that this is a disease that is going to go on for a long time. And so lockdown is not a permanent measure. And so as we have now learnt, and we from the rest of the world, that we've also learnt from what we've seen, and we now understand things a bit better, we can now start to look at other less blunt instruments than lockdown because of the knock-on effects and the significant trade-offs that we have on the economy and on hunger. So those kind of things start to mean that it's all around behavior change. And we really need to understand that lockdown is that blunt instrument for physical distancing. But going forward, we're going to need to all change our behavior to make sure that physical distancing becomes part of what we do, in addition to our hygiene measures. So we need to make sure that wherever we go, physical distancing is part of what we do, masking is part of what we do, and of course, hygiene measures. And people forget that hygiene is incredibly effective. We just think that it's too simple, that it can't possibly be that way. But in fact, hand washing and respiratory hygiene are incredibly effective measures if we do them properly. Yeah. We're just not used to doing them properly.
Simple soap. Very quickly, last question. The Premier is saying there is a new phase in the Western Cape for this virus, which eventually will be seen across the country. I mean, what is the Western Cape gearing up for now? An exponential increase?
Pretty much. So we've literally gone in the last 4 weeks. We've seen almost a number of about 100 daily increase in cases. So 3 weeks ago, we were sitting on about 193 per day. A week later, we were sitting on 250 a day. A week later, we were sitting on about 370 a day. And now we're already on 600 a day this week. So that is showing us that the slope of our curve is significantly higher. But remember that in a sense, similar to the way that South Africa could look at the rest of the world in terms of its increasing slope, now Western Cape is slightly ahead of the rest of the country. Of course, that is dependent on whether the rest of the country are detecting what they should be detecting. So the rest of the country may also be at an increased rate versus what we're seeing in the Western Cape. So we are moving into all epidemics have phases. We start off with the traveller phase, moving into the cluster phase, moving into local transmission, which is pretty much where we are now, and then we move into generalised community transmission, which is what we're slowly moving into now. Well, not so slowly.
All right, sure. That is the reality of the situation. Dr. Kerrin Begg from the UCT Faculty of Health Sciences. We were zooming in there on the Western Cape.